that okay? Can you hear me if I... well, thank you very much. I really want to thank Shane for inviting me because it tells you that Caffeinated Thoughts is not a subsidiary of Iowa Public TV or the Des Moines Register, or a Libertarian wouldn't be here. But here I am, and I'm here to talk to you about Obamacare. By the way, I want to say one thing first. The one thing that isn't in my bio is that at one point I was the lowest paid spine surgeon in America because I stayed home to raise my kids and I was a homeschooler. And I want to say what an honor it is to hear Michael Ferris. You know, we didn't have a lot of money in those days, but the money I spent on being a member of HSLDA was well spent because I always knew that he had my back, and I want to thank you very much for what you do for homeschooling. So, well, anyway, I'm here to talk to you today about Obamacare, and I really want to start with a quote from C.S. Lewis. And this is C.S. Lewis talking about the progressive movement, and he says, "Progress means getting nearer to the place you want to be. And if you have taken a wrong turning, then to go forward does not get you any nearer. If you are in the wrong road, progress means doing an about turn and walking back to the right road. And in that case, the man who turns back soonest is the most progressive man." Now, Obamacare is not really fundamentally different than Medicare. Basically, Obamacare is Medicare on steroids. It's running us down the wrong road. And so today I'm going to mostly talk about the problems of government-run health care, but I'm going to specifically say a couple things about Obamacare. Now, around the world, wherever government-run health care is taken on, they tell you there are 3 reasons that we need government to get involved in our medical system. The first one is access. They think that they want us to all have better access to health care. They can improve quality. And then the third one I can barely say with a straight face. The government says it can decrease cost. You know, you guys that have businesses, when has the government ever gone into your business and decreased cost? I can tell you, if it doesn't work in yours, it doesn't work in mine either. I mean, let's take that one first. Let's look at Obamacare. You know, my son had, in Iowa, he was 25 years old, my older son, he was 25 years old, he was healthy as a horse, he paid $46 a month for insurance. Now, I had written the governor, and actually my letter is an open letter on WND, you can see online, an open letter to Governor Branstad, why not to set up the Obamacare state exchanges, but he went ahead and did it. And immediately my son's insurance went to $167 a month. My insurance went up 30%, I'm sure yours did. Mine's going to go up another 40%, you know, the next year. I mean, there's no way this is keeping costs down. You cannot add 160,000 plus pages of Medicare regulation plus all this Obamacare overlay and cut down costs. And you know, Iowa, we probably have a new world record. Think about what happened to the Obamacare state exchange. After getting about $120+ million from federal funds, and then my insurance guru friends say they probably collected $5 million a month while they were functioning. Before you could say Solyndra, the whole Obamacare state exchange collapsed in bankruptcy in 9 months. I mean, you know, that's pretty impressive. You know, and no matter how incompetent insurance companies can be sometimes, I've never heard of one going out of business in 9 months. So that was really quite impressive. So cost is out of control, and it's not going to be better with government. Access is another kind of joke along those lines. It doesn't give you better access. I mean, look at the Canadians. You know, we see pictures of people in Ontario standing in line, waiting to get to see the doctor, waiting to get in line to get in line for a lottery to get a doctor. It may take 2 to 3 years to get a primary care physician. I mean, having insurance does not guarantee care. Giving everybody free insurance, and there's no free in lunch, giving everybody this free card that says you have insurance is kind of like giving you a free parking ticket to a parking lot that's all torn up. You know, if you make a system that disincentivizes physicians and crashes hospitals, it doesn't matter how much insurance people have, they're not going to get health care. I want to spend a little time talking about quality. Quality is a joke. The government doesn't understand quality. Now, you know, there is one difference, fundamental difference between Obamacare and Medicare. When Medicare was ushered in 1965, by the way, this is our 50th anniversary, it really was done by stealth. They lied to us, no surprise there, but what they did is they said, we're not here to socialize medicine, we're not here to get in the patient-doctor relationship, we just want to help seniors pay for their health care. Well, clearly that isn't what they did, but that's what at least they said. The architects of Obamacare, on the other hand, make no bones about it. They want to bring us single-party, universal healthcare Canadian style. They love the Canadian system. They think it's the most wonderful system in the world. So I ask you this. If Canadian style healthcare is so great, why did this happen? We've caught two premiers, at least two premiers of Canada, a whole bunch of political bigwigs and sports figures, and most recently, I love this, the former head of the National Health Service in Canada sneaking across the Canadian border in the dark of night to come to America for their health care. Okay? If Canadian health care is so great, why didn't they stay home? This is a fair question to ask. Okay? Now, the World Health Organization, God love them, ranks us 37th in the world behind the Sudan. Really? Does anybody really believe that who can vote with their feet? You know, when the Sultan of Brunei needed his cancer care, trust me, he didn't go to the Sudan. In fact, he didn't go to France or Britain or Canada or any of the darlings of the socialists, right? He came to MD Anderson in Texas. I know, because my friend took care of him. Because he knew his life depended on it. Now, in 2009, there was a very interesting article published in the Lancet Journal of Oncology. This is the British Journal for Cancer Care. And it must have put the proverbial British knickers in a twist to have to publish this, because what they did was they looked at survival from cancer around the world, most industrialized nations. And what they discovered was every way they looked at it, the United States had the best survival for every cancer. And it wasn't chump change. I mean, if you're a man in America, according to this data, you have, on average, you have a 65% 5-year survival from cancer in the United States. But in Britain, God love them, 50 years after the National Health Service, it's 45% and 47% in the rest of Europe. I mean, that's a number, well, if you've been trained in Common Core math, I'll run the numbers. That's a 20% differential, okay? And that's at a level so low for cancer survival, it is about at the level of the old Soviet Union, which was essentially no care at all. I mean, that's pretty pathetic. So who are you going to call? I mean, this is what you have to say about quality. Okay, but I'm here to tell you that as bad as the thing is for quality, access, and cost, that is not why I'm here speaking to you. That is not the big problem with government-run healthcare. Those are big problems. It's not the number one problem. The number one problem of government-run healthcare is what it does to a nation's ethics and what it does to the ethics of my profession, medicine. Because, you know, unfortunately, the truth is government does not produce anything, right? It doesn't produce donuts and it doesn't produce medical care. All it can do is redistribute medical care. It can tell who gets what. And all governments do it on the basis of the utilitarian ethic. The utilitarian ethic was a philosophy, it's an evil philosophy that came from Plato to Kant to Hegel to the German-Prussian education system and thence to America. And basically the utilitarian ethic says this. It says, a society should rationally allocate resources to do the greatest good for the greatest number of people. Now, those are all fine sounding words. It sounds words. Oh, we sure want to do good. We sure want to be rational, right? What does this really mean, though? Okay, now, in industry, it makes sense to rationally allocate your resources. If I'm a light bulb manufacturer and there's no call for 40-watt light bulbs, everybody wants 100-watt light bulbs, what do? I reallocate my resources, shut down the 40-watt line, and I start producing 100-watt light bulbs. Perfect sense. But what is this when we're talking about human beings and lives and medicine? What it means is the government says, we are no longer going to treat this disease, we're going to treat this disease. Oh, wait a minute, we're not going to treat these people, we're going to treat these people, which is fine unless you're one of these people, right? And who are these people that don't get treatment? In every society that does this, they devalue people who cannot pay taxes and contribute to the war effort or contribute to the productive aspect of society. So who are these people? It's disabled children. It's the elderly, the infirm, people with terminal diseases. Remember that as physicians, we took an oath for our patients, not just to cure disease, but to ease suffering. And this is completely ethically backwards from that, okay? Now, okay, here's where I step off the limb maybe. When I was on the campaign trail, I have two boys, I said they were homeschooled, so they're highly trained in sarcasm and innuendo. And they told me, Mom, for the love of God, when you go on the campaign trail, do not speak about the Nazis or the Soviets or people will think you're a crazy person. Well, okay, so you can think I'm a crazy person, but there's a lot of history to be learned from German medicine. You know, forgive me for being old-fashioned, but I have a belief that medicine is between a doctor and a patient, not between a doctor and a government bureaucrat and a patient. Anyway, in Germany, that's true. Hopefully we'll get back to that. Okay, so let me tell you a little about history of German medicine. Before 1871, the Germans had the finest medical system in the world, medical care in the world. It wasn't a system, it was just private doctors treating private patients, okay? And it was such a wonderful system that if you wanted to really learn the science of medicine, at the time you went over to Heidelberg. In fact, even up until World War II, German was the language you had to learn to go to medical school, because most of the great literature in my, before my time, in my father's time, was written in German. But what happened? In 1871, Kaiser Wilhelm was being threatened by the Social Democrats. And his advisors said, Kaiser, we got to give the people something that will make them beholden to the crown. So they thought it out, and brilliantly, they set up the world's very first socialized healthcare system. So the people in Germany became it worked great. It secured the throne. They became dependent on the throne for their health care. These systems always seem to work for about 40 or 50 years before the money runs out. And as the money runs out, you're left with a bureaucracy that has forced to ration care, just like I said. And they did it along the basis of the utilitarian ethic. Now, first, what that meant is we're going to withhold care from these groups of people, But then, as time went on and the German war started and the Nazis took over and everything, it wasn't just that we're going to ration care to these people. They didn't give care to the psychiatric patients first. And then pretty soon they said, you know what? They're suffering. It would be better to give them a general death. And they ushered in a euthanasia program. In fact, they ushered in 2 euthanasia programs. And again, who were the euthanized people? At first, it was the children with disabilities, the elderly, the infirm. It first started out with basically children with disabilities and psychiatric patients. But this became the basis for the Nazi killing machine. And I'm just going to tell you that the doctors, when it started then killing Jews and gypsies and the death camps got underway, doctors were intrinsic to the system at every step of the way. Doctors looked into the death gas chambers. Doctors made the selections at the train stations. Doctors were involved in choosing people for euthanasia. They did it all, okay? And in fact, so the whole society took an ethical turn, and what was truly evil became normal. And I want to read you one other quote here, and this is from when Eichmann was tried in 1961 in Jerusalem. His defense attorney made a comment, and the judge took a step back and said, wait a minute, are you saying that the gassing is a medical procedure? And this is what he said. The judge said, I assume you made a slip of the tongue when you said that killing by gas was a medical matter. To which Servatius, the defense attorney, replied, it was indeed a medical matter since it was prepared by physicians. It was a matter of killing, and killing too is a medical matter. Isn't that a shocking point? But that's the way the Germans started thinking, because that's what physicians were involved in that. And here's the point. And the guys that tried doctors at Nuremberg understood this. There's a big difference. When you work for your patient, your duty is to your patient. But when you work for the government, who's your duty to? When the government starts, and it's a slow creep. Now, in 1941, when the Germans marched into Holland, they told the Dutch doctors, well, you're now part of the Third Reich, and you have to participate in the German medical system. And the Dutch doctors, who still were fee-for-service, took care of their individual patients, took the Hippocratic Oath and believed it, they were horrified. And they said, we're not doing that. These are our neighbors, our friends, our colleagues, our patients. We're not sending them off to be euthanized. And in fact, they were such a pain to the Nazis. The Nazis finally said, listen, if you don't do this, we're going to take away your medical license. Boom, no problem. 100% of Dutch doctors in 1942 gave over their medical license rather than be under the Nazis, right? Rather than participate. Probably one of the most principled acts of World War II. However, let's fast forward to today. In 2000, in the Netherlands owns all health care, and euthanasia is now legal. In fact, euthanasia is the cheapest alternative. So if you're an elderly person, again, you don't necessarily get Medicare care if you get a broken hip. 30% of pediatricians, this data is about 6 years old, but I don't think it's much changed. 30% of pediatricians in the Netherlands admit to euthanizing patients, and they don't always admit it honestly on the death certificate, which means it actually turns out if you're under the age of 10 in the Netherlands, the number one reason for death is at the hands of your physician. How pathetic is that? Basically, they have the system the Germans wanted to give them in World War II. And these are the children and the grandchildren of the doctors that were so principled in World War II. Now, what happened? What happened was the gradual ethical creep of government health care and of spending more time working about compliance to government regulations than treating your patients ethically. Now, I see this today in America. It's starting very clearly, okay? You can say, I'm crazy, this is fear-mongering, that this isn't going on, Okay, my older son, I'm very proud of him. He just graduated from Creighton Medical School, and we went to the ceremony. And he took an oath. It wasn't the Hippocratic oath. At least they had the decency to take Hippocrates' name off this. But he took an oath. And the dean of the medical school said, any doctors in the audience, if you want to stand up and take the oath with him, you may. I didn't stand up. My husband nudged me. I said, I'm not doing that because this is a scam. It doesn't mean anything to these guys. Because my son's going to take an oath that has the oath of privacy, which is one of the most sacred oaths you take when you take the Hippocratic oath. It's the privacy of your patient. And he's going to turn around, and on July 1st, he's going to go to his surgery residency, and he's going to start putting everybody's private medical information into the government-run healthcare electronic medical record, and it's going to get blipped up to these government bureaucrats who have no oath to the patient. That is not privacy. This oath means nothing. But you see, this is how it starts. You start devaluing the words, you start taking away the meaning, the ethics. It's slow. It's a slow slide. It's a very slow slide. Now, I want to say something about death panels, because people keep asking about, are there death panels in Obamacare? And yes, there are. It's called the IPAB. You can look that up. But those haven't really gotten off running yet. But what we already have is death by bureaucrat, okay? And I'm going to tell you a real story, but this happens all the time. Keep in mind, if your insurance company denies you paying for care, they don't deny you the care. You can go out and buy it on your free market. But if you're a Medicare recipient, or even eligible to be on Medicare, you just can't go and pay cash for something. So when Medicare denies your life-saving care, they deny your care. And I'm sure the bureaucrats in Medicare would be horrified to be thinking that I'm going to make this analogy, but basically, it's a killing machine in a way. Now, here's what happened to my friend, and she's a medical executive, so she knows how to work the system. Her father has a bad intermittent arrhythmia, and his doctor applied, 2 cardiologists told him, you're going to be dead within 2 years unless you get this certain kind of pacemaker. So they applied to Medicare, and Medicare denied it. Now, you know that the Medicare bureaucrat that denied it did not know the patient. They didn't look at a picture of Mr. Monk and say, and they didn't call him up and say, Mr. Monk, we're really sorry. We see you look like a nice guy, but we're just going to have to let you die because we don't want to allocate our resources to people like you. Can you imagine anybody doing that job? Just like the Germans understood, most normal people will not sign death warrants. Most normal people will not kill other people. You have to have an impersonalized bureaucracy with a few sadists at the end. And in Medicare, we don't even need the sadists at the end, just a big impersonal bureaucracy. So here's what we do. The first thing we do is we take away your name. We give you numbers. Now, we don't tattoo them on your arm like the Germans did, but we give you a number. So this whole case got sent up to the federal government because patient 53844, 4143, ICD-9 diagnostic code 269.3, needs procedure 63047, he's 73 years old, and he's got a cardiac output of 5.6. Boom, goes up electronically to some bureaucrat in Washington, D.C. who looks at all this, or maybe not, but just puts it into an algorithm and says no, pushes a button, and now his doctor automatically gets an automatically generated letter that says, Dear Dr. Smith, in reference to patient 53844, 4143, upon medical review, it is determined this is not medically necessary. Boom, done. How simple is that, right? No stress to the bureaucrat. He didn't kill anybody directly. Well, I just finished reading a very good book, and it's called Eichmann in Jerusalem, The Banality of Evil. What a great term, Hannah Arendt's, The Banality of Evil. Because this is the banality of evil. It's not, again, that bureaucrat would never admit that they actually would kill anybody or sign a death warrant, but what they did was they through their bureaucratic action, ended up that way. Now, Eichmann, it turns out, did not kill one Jew. He never signed a death warrant for one Jew. He admitted at his trial that he didn't even like the sight of blood. He couldn't be a doctor, and he couldn't stand looking, and he was asked one time to look in a death chamber. He couldn't do it, But he was what we would call in the Army or the Navy a very good logistician, okay? What he did was sat at a desk, and he optimized the use of rolling stock to go pick up Jews and take them to the death camp so that there were no mismatches. He did this extremely well. He was a very good bureaucrat. In another society, he might have been a CPA or an executive for a grocery store, but he just happened to be sitting at this desk. So Hannah Arendt asks the question, what's more evil? The guy who's a serial killer and kills 10 people personally, or the guy who, through his bureaucratic action, arranges the death of 6 million? Now, you know, I mean, like I say, I'm sure that, and I'm sure that they would be horrified in H&HS to hear me say this, but that is where we are going. And you're going to see it more and more. We see it, look at the Liverpool pathway in England. Every society that brings on government health care brings on a culture of death to the degree it's applied. You know, a little bit of Medicare didn't seem to be a problem, but now it's becoming a problem. And look at Liverpool pathway in England, if you're not familiar with that. It's the death pathway that it turns out that you might be admitted to a hospital in Liverpool, and without you knowing it or your family knowing it, you're, instead of being assigned to care, you're assigned to this kind of pseudo-euthanasia program where we kind of assist your death. That's happening all over. Now, there's hope on the horizon. I'm going to leave you with a positive thing to do. And one of the hope comes from, again, the German experience. I used to think that Jews were killed kind of universally in all the places in the Third Reich. That's not true. You see, because bureaucracies are not like armies that just roll over you. Bureaucracies require the victim to organize themselves, just like we're doing. Oh, electronic medical records? No problem. Oh, pay for performance? Okay, we'll do that. Oh, all this compliance in the hospitals? Oh yeah, we'll do that. We'll do all this Medicare review and all this stuff. You have to organize yourself. Where there were no Jewish council of elders, they generally couldn't round up the Jews because they couldn't find them. And in Denmark, when the Germans told the Danes, hey, we want your Jews to start wearing gold stars, they said, well, okay, the first person will be the king, then all the members of parliament, and then every member of the Danish citizenry. Oh, well, that's not going to work. And then they said, why don't you just round them up for us? And the Danes said, no. And the Germans didn't know what to do, and they just kind of went, oh, well, okay, I guess we can't do that. And very few Danish Jews were killed, okay? This is a point to us, okay? I'm kind of like the previous speakers. I do not think that you can go to a federal court, even though I'm past president of AAPS, and the AAPS is the only medical group that has legally challenged Obamacare. But I'm not hopeful that's going to be the long-term solution, because why? It's very hard to go to a federal court and try to explain to them that the federal government is overstepping its constitutional authority and then get a favorable judgment by a federal judge. I think that's kind of maybe stretching our hope. Okay, but what we have the ability to do is not organize ourselves and not accept these things. Okay? You can't just roll over to every federal program. And what I see happening right now around the country is doctors are getting fed up with this, and we're leaving the Medicare plantation and we're going out and having cash practices. I actually have a little anti-aging cash practice on the side that I do. And there are many of my colleagues at the APS, they're primary care physicians that work for cash. This is a wonderful system. Even Medicare patients are choosing to go with them because they get a better value for their dollar than they do through seeing doctors that look like they're selling you a computer, you know, on their computer looking like they're selling you an airline ticket. So there is hope by doing this, is the cash practice. And actually I've published an article you can find online. It's called The 3 C's Access to Care, something like that. And it's about cash, catastrophic insurance, and charity. This is the way we did medicine for 1,000 years. And we can go back to this locally. Forget the federal government's lost maybe, but we can do it in the state of Iowa. Here's the action point. And here's what's going to happen. As more doctors become free market again, as we go back to the old country doctor way of practicing medicine again, the government's not going to like it. And what they're going to do, just like the Nazis did to the Dutch, they're going to say, if your doctors in the state of Iowa don't practice under our government system, we're going to not give them, you can't give them a medical license, or we're going to withhold our federal funds. And the state medical board will roll over to that. And I'm asking you, don't let that happen. If you want to preserve medicine in the state of Iowa, you have to not let that happen. That's the window. It's the very small step that we can take that will make a big difference, and that's allowing freedom and free markets to bloom in Iowa in medicine so that you have a doctor in the future. I wrote a book, Surviving the Medical Meltdown, because if we don't do that, this is what's coming. You won't have a doctor in the future. You have to save yourself. Anyway, so in conclusion, I think it's time to do what C.S. Lewis said, and we need to back up and go down the right road, and government medicine is not the right road. Thank you very much. Time for any questions?
Or one question, I think. We can get one question. And anybody have that burning desire to ask a question?
What would you suggest for a single person in their 20s who is looking to get an insurance plan to go with a private insurance plan on their own, a medical sharing option, or Obamacare, which I personally am not interested in.
Well, I'll tell you, I'll tell you kind of a funny story. I mean, when I was trying to get, when the Obamacare state exchanges, and my son's insurance went up, and I got this letter, and I said, and he had private insurance at the time, there were three options. And the first option was, you know, your insurance is going up to $169. If you want to keep this option and to talk about the rates, call this number. The second option was to call this number if you want a different policy. And then the third number was call the Obamacare state exchange. Well, I would rather sell him into slavery than put him on the Obamacare state exchange, so I called option number 2, the different policy, or maybe option number 1. But I got the guy at the Obamacare state exchange. And I kind of was, after a minute, I was kind of rude to him. I said, you don't get it. I don't want Obamacare. Boom. Okay, so then I called back at option number 2, and again I got the Obamacare state exchange. And I finally said to the guy, I said, are you the only guy in the state of Iowa I can talk to about my son's insurance? He said, like I was falling off the turnip truck, you know, he says, you don't understand. There's really only one insurance now. You just have to choose, will you pay for it, or the taxpayers of Iowa are going to pay for it? Does he qualify for Medicaid? So I don't know, I have to apologize that I don't know the complete answer to your question, because as the exchanges have collapsed in Iowa financially, I don't know what's taking their place. But you see, Obamacare is not really an insurance policy, it's an umbrella. And it makes federal law that applies to all private insurance. And here's the way it works, unfortunately. I mean, I believe in high deductible private insurance. You know, that's what insurance used to be. It was not, insurance was for when your roof, like your house insurance works, because when your roof blows off, you call your insurance agent. But when your shingle blows off, you reach into your own pocket, not your neighbor's, you reach into your own pocket and you put the shingle back up, okay? And that's the way health insurance used to work. You didn't use it for little wellness checks and your common cold and all this. You used it when you broke a femur, had a heart attack, or got run over by a bus, God forbid. You know, so that's what real insurance is for. I just don't know, but now what it is, see, this is why I found out, this is why the insurance companies liked the ACA, Obamacare, because they can now force you to buy a product at 300% the market value. And they've got you captive because there's a very small window of opportunity where there's open enrollment, and then the rest of the year they can deny you care until you can open enroll in another policy. So it's tough. I think the private insurance, I like the medical sharing through like Samaritan Ministries. You know, as long as people are responsible, those things will work. And I think there's also MediBid, which connects cash doctors to cash patients. I think it's a good idea to look for a cash doctor, because we'll be the last people standing when this thing comes crashing down. The system is made to crash the hospitals and to crash people out of private practice. My colleague is a general surgeon. His father, who also works in our hospital, is a 92-year-old general surgeon. They've been in practice for 40 years, and they're now being sold out to the hospital because they cannot make it in private practice. So, thank you.